We discussed in detail about the pathophysiology of the pneumonia, but these lecture will be very long, I must tell you, because we will discuss about the different types of the treatment in the lobar pneumonia, okay, including that I will tell you about the CURB 65 score for pneumonia severity, what happens when the complications of the pneumonia occurs. I will explain each and everything, okay. So you must have patience. Now we will discuss about the different types of the pneumonia, and I will tell you which one is the most common and which one is the mostly asked in the exam especially, okay. So for example, the very first one, okay, we will classify the pneumonia on the basis of the where it is acquired, for example, right. uh, we will do the classification on basis of, okay, classification we'll do on basis of the where actually the pneumonia is acquired, where pneumonia is acquired, okay, right. Now listen, it basically means कि जो pneumonia हुआ है, is it basically outside the hospital, और ये हॉस्पिटल में आने के बाद निमोनिया हुआ है पेशेंट को, या तो फिर पेशेंट को वेंटिलेटर देने के बाद निमोनिया हुआ है, राइट. वी विल डिस्कस दिस on the basis of the where the pneumonia is actually acquired. So the very first one is actually the community acquired pneumonia. What basically community acquired pneumonia means? It means the pneumonia has occurred outside the hospital, inside some community, okay. In short, outside the hospital. अगर किसी पेशेंट को निमोनिया डेवलप हो आउटसाइड द हॉस्पिटल, so that is called as the community acquired pneumonia, okay. Now what happens in the community acquired pneumonia? Listen very carefully. The most common cause in the community acquired pneumonia is basically streptococcus pneumonia, streptococcus pneumonia, and the same community acquired pneumonia will cause lobar pneumonia. So it will cause lobar pneumonia. Lobar pneumonia. What is meant by the lobar pneumonia? Let me tell you. For example, in this diagram, you can clearly see, right? This is our right lung, which has three lobes. Okay, the very first lobe is called a superior lobe, then middle lobe, then inferior lobe. And left lung, obviously, it has two lobes. Okay, the superior and the inferior lobe. अच्छा, तो अब क्या है कि जैसे ही किसी को कम्युनिटी एक्वायर्ड निमोनिया होता है, उन पेशेंट के अंदर, उनके लंग्स के अंदर एक स्पेसिफिक लोब होता है जो कि अफेक्टेड होता है, राइट, निमोनिया की वजह से. फॉर एग्जांपल, इस लोअर लोब के अंदर जितने भी, इंफीरियर लोब के अंदर जो फॉर एग्जांपल लंग पेरेन्काइमा है, लंग के अंदर जो फंक्शनल सेल्स है वो सारे डिस्ट्रॉय होते हैं, ओके, राइट. या तो फिर उनके अंदर इन्फ्लामेशन काज होता है. तो इसीलिए हम इस टाइप ऑफ निमोनिया को क्या कहते हैं? लोबार निमोनिया कहते हैं, ओके, जिसमें हमारे लंग्स का सिर्फ एक स्पेसिफिक लोब इन्वॉल्व हो, दैट इज कॉल्ड एज द लोबार निमोनिया. और ये हमें किस में मिलता है? ये हमें मिलता है एक कम्युनिटी एक्वायर्ड निमोनिया में. एंड ट्रस्ट मी, यू विल हैव lots of questions about the community acquired pneumonia, lobar pneumonia, okay. Other pneumonias also you will have question, but mostly you will have questions from these two: community acquired pneumonia, which will cause lobar pneumonia, okay. द नेक्स्ट इज द हॉस्पिटल एक्वायर्ड निमोनिया. अब ये नाम से ही जाहिर है, हॉस्पिटल एक्वायर्ड का मतलब जो निमोनिया हॉस्पिटल के अंदर हो, ओके. द मोनिया द न्यूमोनिया विच इज एक्वायर्ड इन द हॉस्पिटल, ओके, और आई मस्ट से आफ्टर 48 hours of the admission in the hospital, after 48 hours, okay, yeah, more than 48 hours after admission in hospital. So this is actually called as the hospital acquired pneumonia, right? Acha. When we discuss about the hospital acquired pneumonia, it mostly causes bronchopneumonia, okay. Yeah, तो फिर it often causes bronchopneumonia. I will tell you what basically bronchopneumonia is, okay. Bronchopneumonia. ब्रोंको, फ्रॉम द वर्ड ब्रोंको यू कैन जज इट, ओके, कि ये जो है ये किसको इन्वॉल्व करता है? एक तो ये हमारे ब्रोंकाई को इन्वॉल्व करता है, उसके अलावा यहाँ पे जो ब्रोंकाई के ब्रांचेस निकलते हैं विच आर कॉल्ड इज दी ब्रोंक्यूल्स, ओके. तो ये ब्रोंकाई एंड ब्रोंक्यूल्स को इन्वॉल्व करता है, वहाँ पे जाके ये इन्फ्लामेशन कॉज करता है, ओके, राइट. Fine. So, yes, here the most common organism is the Streptococcus pneumoniae. Okay, and when we discuss about the hospital-acquired pneumonia, here the most common organism is the Pseudomonas, MRSA, Klebsiella, etc. Okay, let me write down here for you most common organisms that you will see in the hospital-acquired pneumonia. The first one, Pseudomonas. Pseudomonas, right? After Pseudomonas, sometimes these can also occur due to the MRSA. which is called as the methicillin resistant Staphylococcus aureus or Klebsiella, right? Klebsiella. Now these are all present in your book. Okay. Right. The last one is the ventilator associated pneumonia. From the name you can judge कि ये कब होता है after 48 hours of the intubation. Okay. So these occurs after 48 hours of the intubation. After 48 hours of intubation. Simple. These type of pneumonia is called as the ventilator associated pneumonia, right? इसमें भी हमारे pseudomonas mostly involved होते हैं. Okay, so these are the basically classification of the pneumonia, okay, on the basis of where it is acquired, whether it is outside the hospital, it is inside the hospital, or it is because of the ventilator. The next classification that I will do, that is the the next classification is on the basis of the location. Okay, classification on basis of location of the pneumonia. Location of pneumonia. Okay, I will tell you here इसमें इसका मतलब क्या है. Listen very carefully. The very first one is called as the lobar pneumonia. What is lobar pneumonia? Lobar pneumonia basically means when it involves entire lobe of the lung. When it involves entire lobe of the lung. Okay, for example ये वाला जो ये हमने यहाँ पे पढ़ा था, this is the lobar pneumonia. Okay, और ये किस में होता है? Mostly community acquired में. So the lobar pneumonia involves our entire lobe. Okay, including that what you see in the lobar pneumonia, it has different stages. These lobar pneumonia is having different stages, as we discussed in the previous lectures, right? The very first stage is called as the congestion, between 1 to 2 days, obviously. The next stage was the red hepatization. If you remember, we discussed red hepatization, जिसमें हमारा जो लंग है वो उस जहाँ पे फॉर एग्जांपल ये इन्फ्लेमेशन होता है वो बिल्कुल लीवर की तरह, राइट, लीवर की तरह वो रेड कलर का होता है. ओके, रेड होता है. फिर उसके बाद रेड हेपेटाइजेशन के बाद जो है ग्रे हेपेटाइजेशन होता है. ग्रे हेपेटाइजेशन, right? These was actually the third stage of the lobar pneumonia. What was the fourth stage? Fourth stage was the resolution. Okay, जिसमें जो हमारा pneumonia है वो मुकम्मल तौर पे ख़त्म होता था due to treatment. So these are the stages of the lobar pneumonia. The very first one is the congestion, the second is the red hepatization, the third one is the gray hepatization, the fourth is the resolution. Okay, now which organism basically cause this lobar pneumonia? Again, we have Streptococcus pneumoniae. Streptococcus pneumonia. अगर आपको लोबार नमूनिया समझ आए तो आपको कम्युनिटी एक्वायर्ड नमूनिया भी समझ आएगा, या तो फिर अगर आपको कम्युनिटी एक्वायर्ड नमूनिया समझ आए तो आपको लोबार नमूनिया भी समझ आएगा. सिंपल. ओके. अच्छा, इंक्लूडिंग दैट एक तो ये स्ट्रेप्टोकोकस निमोनिया की वजह से होता है, एंड दीज विल कॉज कम्युनिटी एक्वायर्ड pneumonia as we discussed here. Simple. So the same points are being repeated. Okay, there is no difficult thing. Okay, then we discuss about the bronchopneumonia. What is basically bronchopneumonia? Bronchopneumonia basically means जब ये हमारे bronchi या bronchioles को involve करे, okay, inflammation. So that is called as the bronchopneumonia. अब bronchopneumonia mostly किन patients में होता है? ये होता है old patients में, right? या तो फिर कुछ ऐसे patients होते हैं जो कि बेड रिडन होते हैं, बेड रिडन पेशेंट्स. ओके, या तो फिर हॉस्पिटल पेशेंट्स, हॉस्पिटल पेशेंट्स, right? And what is the most common organism in the bronchopneumonia? That can be pseudomonas, that can be, for example, staphylococcus aureus. Let me write down pseudomonas or staphylococcus aureus. As we discussed here, pseudomonas, staphylococcus aureus, and these mostly occur bronchopneumonia in the older, bedridden, and hospital patients. And what you see, for example, in the X-ray of these patients. Let me write down. When we discuss about the lobar pneumonia X-ray, in these X-ray you will see consolidation. Okay, you will see consolidation. और एज आई डिस्कस्ड कि ये हमारे लंग्स के अंदर एक स्पेसिफिक लोब होता है जिसको इन्वॉल्व करता है. तो जब आप एक्सरे के ऊपर देखोगे, एक्सरे के ऊपर आपको एक लंग के स्पेसिफिक लोब के अंदर आपको वाइटिश कलर नजर आएंगे. ओके, राइट, वो रेडियो पे आपको वो वाला एरिया नजर आएगा, वाइटिश वाइटिश सा आपको नजर आएगा. सो दैट इज एक्चुअली लोबार नमोनिया. उसके अलावा जब हम ब्रोंको नमोनिया की बात करते हैं, ब्रोंको नमोनिया में जब आप एक्सरे करते हो, एक्सरे के अंदर आपको क्या मिलता है? इसमें पेची डिस्ट्रीब्यूशन मिलता है. पेची डिस्ट्रीब्यूशन ऑफ द या पेची इन्वॉल्वमेंट ऑफ द ब्रोंकाई. ओके, I will write it here. Patchy involvement. You will see patchy involvement in the bronchopneumonia. I will show you the X-ray also. Okay. Right. The last one is the interstitial pneumonia. This interstitial pneumonia is also called as the atypical pneumonia. Okay. Atypical pneumonia. Now, what is in the interstitial or atypical pneumonia? अच्छा, इसमें जो है हमारे लंग्स के जो फॉर एग्जांपल इंटरस्टिशियल टिश्यू होता है, राइट, वो इन्वॉल्व होते हैं, राइट. सो इट इन्वॉल्व्स द इंटरस्टिशियल टिश्यू, इंटरस्टी interstitial interstitial tissues, okay, not alveoli, not alveoli. So it basically involves our interstitial tissues of the lung and not the alveoli. And इसमें जो most common organisms है, that can be mycoplasma pneumonia, okay, that can be mycoplasma pneumonia. There can be some kind of viruses and sometimes some fungi, okay. This can also occur due to the chlamydia. ओके. सो माइकोप्लाज्मा की वजह से हो सकता है, वायरसेस की वजह से, क्लेमाइडिया की वजह से हो सकता है. फाइन. सो दिस इज द इंटरस्टिशियल pneumonia, right? In the next lecture I will tell you about the, for example, history of physical examination. जब हम करते हैं तो ये पेशेंट्स हमें कैसे दिखते हैं.